it was argued that the tax break would not help those who pay no taxes. Obviously, that's true. Tax breaks don't help you if you don't pay taxes. But the saving of actual cash money that would otherwise be sent to the insurance company is very attractive, even if you don't pay taxes. It was argued that selection would raise costs for other types of benefit programs, for non-consumer driven healthcare program. Now, we are seeing some selection out there. The concept of selection means that high-risk people choose one thing, low-risk people choose something else, and they select themselves into different benefit programs. What we're seeing, though, is based on education, which is not too surprising when you think about it. Better educated people have more self-confidence in their ability to deal with a complex system like healthcare. So better educated people are more innovative, they're more apt to choose a health savings account over an HMO or some other form of coverage because of that self-confidence. And we are getting a better educated population being the first people to choose these programs. And because they're better educated, they are probably higher income and they're probably more healthy. But the key factor is the level of education more than income or health. And the savings seem to be system-wide. Everybody seems to be benefiting from it, whether they're in a consumer-driven plan or not, because the non-consumer-driven plans are learning some of the lessons that the consumer-driven plans are teaching. A lot of people said consumers are not capable of making their own decisions in healthcare. And they begged the question of, if consumers aren't making their own decisions, who should be making their decisions for them? You know, I used to be in the insurance industry. I was an executive for Blue Cross Blue Shield. I give talks like this fairly often, and I often volunteer to make your healthcare decisions for you. Pay me $10 a month, and I will make all your healthcare decisions for you. I'm qualified. I was an insurance executive. I can do that. And I've yet to have anyone take me up on it somehow. You know, somehow you think that you are better qualified than I am to make the decisions about what kind of health care you get. It astonishes me. But there you have it. A lot of people said, well, we can't let consumers do that because they don't have enough information yet. So we should wait until there's plenty of information available for them. And actually, that's kind of putting the cart before the horse. First of all, you give people the power, and then they will demand the information to use that power. In fact, all the years that I've been in health insurance, we've been browbeating consumers to become better educated, pay more attention, learn the terminology. And it hasn't done a thing, because what would they do with the information if they had it? They were not in a position to make decisions. Us insurance companies were making the decisions for them. Now that they can make their own decisions, now they're demanding information, and there's simply an explosion of patient support and information services coming out in the marketplace. And then an argument was made that high out-of-pocket expenses would prevent people from getting timely care and lead to worse conditions later on. And in fact, we're finding just the opposite, that the actual experience in the marketplace shows that people are more invested and they understand their need for care, timely care, better than the passive person in an HMO. Plus, prevention is usually covered on a first dollar basis in most of these programs. All right, so the results 6 years later, we're seeing patient behavior is changing. People are being more cautious about the needless use of services, and I'm going to run through some numbers illustrating these results in a minute. Consumers are more compliant with their treatment regimens, particularly those with chronic conditions, diabetes, asthma, arthritis, congestive heart failure, those kinds of conditions. They are doing a better job of following the treatments that have been prescribed for them. The rate of increase in healthcare costs is down substantially for people and groups in these plans. In fact, to the point that the trend, the annual rate to annual year-to-year increase is about 1/3 that of HMOs and PPOs. Again, I'll support this with evidence in a second. The demand for information, transparent prices, and patient support services is very high. The adoption rate in the benefits market is absolutely sizzling. These things are growing by leaps and bounds. And the transformation of service delivery is beginning, even though it's still very early in the process. And we'll talk some more about that, too. Okay. Now, these are really tedious slides. Again, I apologize, but I want you to know that I'm not just blowing smoke. There are a lot of studies out there being done. Now, there are some surveys like EBRI, the Employee Benefits Research Institute, does an annual survey. It's an online internet survey, and they find all these bad results. But their first survey actually included, I think it was 121 people that actually had consumer-driven health plans, and they extrapolated 121 people to the entire nation and came up with conclusions. And surveys don't really work in this kind of business because people may not know if they have an HRA or an HSA, and they don't know the terminology that well, and it's hard for them to answer survey questions. But the vendors are tracking this with precision, and they know exactly what is happening with their own populations. And that is much more reliable information, I think. So the Blue Cross Blue Shield Association last year found that consumer-driven enrollees are much more likely to research doctor costs, research hospital costs, track their own healthcare expenses, estimate what their future healthcare expenses are going to be, and save to meet those future expenses. Cigna in 2006 found that consumer-driven enrollees had 11% lower costs for pharmaceutical, 24% lower costs for inpatient care, almost 11% lower for outpatient care. Better compliance, the Blues found, again in 2007, that CDHP enrollees were researching doctor quality, researching hospital quality, and so on and so forth. McKinsey did a really interesting thing as far back as 2005. They found that consumer-driven enrollees were more likely to comply with treatments than people in traditional plan, 36% versus 27% for diabetes, 51% versus 31% for high blood pressure.